again, everyone. I'm Doug Fischesser.
And I'm Doug's new co-host, Renee Nesbitt. Welcome to Fayette Regional Health Talk.
Welcome indeed, Renee. It's good to have you on the show. We'll have some fun this year.
Thanks, Doug. Looking forward to it.
Before we get started, tell us a little bit about yourself and where you work at Fayette Regional.
Sure. As I said, my name's Renee Nesbitt. I've been born and raised in Connersville. We've been married for about 8 years and just had our first little bundle of joy about 2 years ago. I have a bachelor's in behavioral and social sciences, and I work at Fayette Regional's Jerry Sykes Services as the community education manager.
Great. Well, it's great to have you. Thanks for that info, Renee. Welcome aboard. Health Talk is your source for health and wellness topics in the Whitewater Valley, and Fayette Regional Health Talk provides up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley.
Leading this episode of Health Talk, we would like to welcome Dr. Douglas Lawson to the Team Fayette Regional Healthy Women OBGYN. Dr. Lawson joins Dr. Amy Wynn and the experienced staff at their Western Avenue location.
As a reminder, Fayette Regional offers the area's best balanced pain treatment plans through board-certified pain management physician Dr. Danielle Turnak of the Pain Management Group. With the goal of increasing patient functionality, Dr. Turnak creates a tailored care plan specific to each diagnosis along with a custom service agreement to help ensure compliance with the care plan. The Fayette Regional Pain Management Center is accepting new patients. Call today.
It's hard to believe that the year is almost over, and it's again time to think about health insurance enrollment. Healthy Indiana Plan HIP 2.0 is now available for many more Hoosiers. Choosing a healthcare provider, determining monthly premiums, and understanding health insurance plans may be confusing, but our on-site expert is here to help. There are inexpensive plans that include medical, dental, and vision care. Fayette Regional has resources and staff that can help you sign up. Call 765-827-8998 or visit fayetteregional.org/HIP for more info.
Cold and flu season is here, and so is Fayette Regional Health System with extended hours for your primary and immediate care needs. Fayette Regional Primary Care Center has a full staff of experienced physicians and nurse practitioners. They can take care of all your immediate care needs 7 days a week, and walk-ins are welcome Monday through Friday, even on weekends for adults, seniors, and kids too.
When we return, our guest will be in studio to help give us a few more details about HealthWorks therapy and rehabilitation at Fayette Regional. We'll be right back.
Walk-ins are welcome at Fayette Regional Primary Care Center. Open 7 days a week for when children, adults, and seniors need to see a doctor. Open until 9 p.m. Monday through Thursday, till 6 on Friday and 9 to 3 on weekends, with both doctors and nurse practitioners on staff. No appointment necessary. Located right in Connersville, just 1 block from the hospital, the Fayette Regional Primary Care Center.
Hi, my name is Larry Myers, and I've lived in Connersville 45 years.
Larry Myers is known as the voice of Spartan Bull. When he was experiencing abdominal pains, he went to his general practitioner, Dr. William Nesbitt, who immediately sent him on to Fayette Regional Hospital.
I really didn't know what was wrong, and came to the hospital on Wednesday afternoon and had an MRI and had emergency surgery that evening.
Larry received emergency appendectomy surgery by Fayette Regional Vascular Surgeon Dr. Dennis Kneffler.
I'd like to thank everyone here at the hospital, from the front desk to the surgical nurses to my nurses in intensive care and Dr. Kneffler. Everything was just wonderful here. Can't say enough about my stay at Fayette Regional. It's a great value to the community in Connersville to have Fayette Regional here locally.
Welcome back. Join us now are Kate Timpson and Tara Roberts from Fayette Regional HealthWorks. Thanks for joining us, girls.
All right, thank you, Doug.
Thanks for having us.
We appreciate you joining us today. Let's start out by telling us a little bit about yourselves. Kate, let's start with you.
Thanks, Doug.
Well, my name's Kate. I'm not originally from Indiana. I'm a native of Pennsylvania, and I just recently graduated from physical therapy school in January of 2015. My background, I have a Bachelor's of Arts in Psychobiology, and then I went to graduate school and got my Doctor of Physical Therapy in 2015, and I've been working with Fayette Regional since June of 2016.
Great, thanks. Tara, how about you?
My name's Tara Roberts. I am a native of Connersville, born and raised here, moved away with my husband, came back. We have 2 little ones, and I have a background. My bachelor's is in sociology, and I have a master's of occupational therapy through IU.
I should point out, too, that your husband, Jordan, played 4 years of golf for me for CHS and was a very, very good player.
That he did.
Help me out.
Thanks.
Exactly. Kate, you're a physical therapist, and Tara, you're an occupational therapist. Could you each explain the difference between the two? Kate, how about you?
Sure, Doug. So both Tara and I focus on helping rehabilitate people, getting their motion back, helping them prevent any further injuries, and just getting them back to a better quality of life. Particularly in our setting, I focus more on helping people who come in with spinal issues, things going on with the lower extremity, such as the hips, knees, ankle, and foot. Also deal with neuromuscular injuries, such as a stroke or brain injury, not seeing that as much, but chronic pain as well. But again, in the hospital setting, mainly sticking with the spine and lower extremity.
I see. Tara?
And as for occupational therapy, mostly we're treating upper extremities, so the shoulder, elbow, hand, wrist, fingers. Also, we work with some nerves if we have some nerve impingement, and as well as we treat some kids. So if you have sensory or fine motor delays, we will treat kids in our setting, as well as with Kate, stroke. But with that, we're working more on the activities of daily living. So getting back to dressing, bathing, grooming, hygiene, some things that might be limited due to an injury or a diagnosis.
I see. I see. Now that we know the difference, let's talk a little bit about the therapy services that you each provide at HealthWorks. Kate?
All right, so as far as therapy services that I provide, I'm dealing a lot with, as far as modalities or tools that we use a lot of electrical stimulation as a way of help modulating pain, along with doing things like strengthening and stretching to help with range of motion and getting someone more mobile. We also use ultrasound occasionally just to help with any inflammation or some swelling, but I would say our biggest modality that we use is probably the electrical stimulation, and then also helping with people getting back to walking, so gait training, balance training, just making sure that they're safe with their daily lives.
I see.
As for occupational therapy, some different services we offer would be the paraffin bath, where we can, dip your hand in there, get it nice and warm prior to doing treatment, whether that's stretching, and even before we even get the strengthening going, we can dip the hand in. We can also use some moist heat. We also use ultrasound like physical therapy for some edema, for swelling, as well as the other services, soft tissue manipulation. We can do myofascial release. So if you have some really tight muscles, sometimes there's a strategy that we can use to help soften the tissue, as well as stretching, strengthening the muscle. Those are some services that we offer.
I see. Great.
Jeez.
With those services, Kate, what diagnosis do you treat?
So right now, I'd say a lot of the diagnoses that we treat are people coming in with pain, either pain complaints going on with any part of their spine, so neck pain, back pain. We also have a lot of patients coming in for physical therapy after they've had a joint replacement. So right now we have a lot of patients utilizing our services who have had a total knee replacement, a lot of people coming in with foot and ankle sprains, also just some generalized hip pain. And as Tara mentioned too, we occasionally see some kids, and when these kids come in, most of the diagnoses that I treat with them are dealing more with gross motor development. So maybe teaching them how to walk, getting their balance back together, just developmental skills that they should be meeting, and they might just be a little bit slower at getting based on their diagnosis.
Oh, great. Okay. Interesting. Tara, how about you? What diagnoses do you treat?
Well, right now, some common ones in our clinic, orthopedic-wise, rotator cuff repair. We get a lot of shoulder pain, and elbow. If you break the elbow or fracture the elbow, some people actually get hardware put in. Some don't have to have that. Distal radius fracture, that is usually when the bone breaks at the wrist, usually result in a fall. And then we get a lot of finger injuries. I've had some lacerations, some amputations, and that's more the orthopedic side. Then we have the neuromuscular and stroke-related injuries. And then also we see the kids, and again, like that's autism, sensory-based, fine motor, gross motor delay, just developmental gross delay. We will work on those.
I see. Who is your typical patient normally? Tara.
Typically, we're seeing more of the orthopedic, so that's your shoulder, elbow, wrist injuries, either after surgery. Sometimes they don't always have to have a surgery. They just had a brace, or just they've sat in one position for a while to let the bone heal without surgery, and now the muscles have gotten shorter. So see those, and then I get a handful of kids as well.
I see. Okay. Kate, how about you?
For my typical patient, thanks to Dr. Turnak, we do get a lot of patients referred to us from pain management. So a majority of our patients are coming in with complaints of neck pain or back pain, but we also get our orthopedic patients as well. So those coming in after they've had surgery, like a total knee or a total hip replacement, basic ankle sprains and strains or muscle strains as well. And then just a handful of kids coming in as far as developmental diagnoses like cerebral palsy or anything along the neuromuscular route there.
I see. Kate, back to you again. What should the patient expect on an initial evaluation at HealthWorks when they first come in?
So for their initial evaluation, I'm basically just taking numbers as far as looking at someone's strength in their legs, looking at their motion, at whatever joint is bothering them. I also like to try and check the joints above and below. For instance, if someone is coming in with neck pain, I also like to just grossly check to see what their shoulders are looking like, just to see if that may be something that maybe I should refer to Tara. Or if someone is coming in with back pain, I also like to check out the hips, see if the problem may be coming more from the hips rather than the spine. So we do a lot of objective measures, so just getting numbers down as a way to try and track the patient's progress, a way for us to make goals for the patients in therapy, and then setting them off with some home exercises that we review with them so that they can maximize their potential in therapy, and then get them set up for further appointments.
I see. Good. How about you, Tara?
Well, I like to tell all my patients when you come in, our goal is not to hurt you. I feel like that's always my thing once they get going, like, oh, I thought I was thinking you were going to hurt me. I'm not. That's not our goal. Not our goal for that first time. Not our goal either as we get going. But when you first come in, the biggest thing is we have to get range of motion. We need to see where your strength is. If you have something with a nerve, I want to check the sensation and see if you're able to have a fine sensation down at the fingertips. And like Kate said, we do a home exercise program. We go over those. So while you're waiting until we get to see you on the schedule again, there's things that you can be starting at home. But the biggest thing is range of motion, strength, and really that's it for the first initial, and then we'll get going, and then we can actually start seeing some progress with therapy.
I see. Good. I have to ask about the pool. It's rare to have a therapy pool, especially on the third floor. How important is the pool for each of your specific therapy services? I'll start with you, Kate.
I would say that physical therapy uses the pool for the majority of the patients compared to occupational therapy, just in the sense that when we have someone coming in with multiple joint pain, the pool offers an option for someone to do exercises in an area where they have less joint loading or weight on their joints, so that buoyancy from the water helps them participate in exercises that may be a little bit limited when they're doing things what we call like on land or in the gym.
Right.
And having the pool being heated too allows the muscles to relax and let the person relax too, so that they can progress through their therapy, help decrease their pain, and get stronger.
Yeah, that's got to really help. How about you, Tara?
Yeah, like Kate said, PT does use it more than occupational therapy, but I have been getting some patients in the pool mostly when we're working on strengthening of that upper extremity, and while we're doing it on land, there's just some more pain with it because of gravity impacting some of that joint. So we'll get them in the pool, work on some more strengthening. So I use it more just strictly for strengthening at this time.
I see. Great. Final question for both of you. How does someone get referred to HealthWorks for therapy services? Kate, I'll start with you.
Well, I'd say most of our patients get referred by primary care doctors in the area. We also get a couple referrals from orthopedic doctors in the surrounding states like Ohio. And also word of mouth is a great way for us to get patients as well.
I see.
And in addition to what Kate was saying, even though you go have a surgery, sometimes we get patients coming later going, oh, well, my doctor only gave me this option. As a patient, you have that right to choose where you want to have your therapy. So when you are in there and they are writing your script, you can say, I'd like to go to HealthWorks Rehab, and that way you can come see us. But it is a doctor referral service.
Oh, great. Well, thanks to both of you for coming by today. You've helped a lot with a lot of HealthWorks information, therapy, and rehabilitation services, and we really appreciate you stopping by. Thanks again.
Yep, thanks for your time.
Thank you, Doug.
Thanks again. We'll be right back.
Fayette Regional Mental Health Minute.
Has anyone ever pointed out to you that you often run late, or that you're unprepared? How about that you never finish a project, or you often misplace things? You can't seem to sit still. Have you ever thought, I've been like this my whole life. There's nothing I can do about it. If this sounds familiar, you might have ADHD or attention deficit hyperactivity disorder, a common neurological behavioral condition that is very treatable. Many adults not diagnosed in childhood still exhibit symptoms as adults. There is something you can do about it. Contact Fayette Regional Care Pavilion Jerry Psych Services at 765-827-8022. Give life the attention it deserves. Fayette Regional Care Pavilion Jerry Psych Services. There is help, there is hope.
Welcome back. Joining us now is Anita James Brown from Fayette Regional. Thanks for joining us, Anita.
Thanks for inviting me, Renee.
Let's start with the basics and tell us a little about yourself and your job at Fayette Regional.
Well, I've been in Connersville my entire life. I have worked at Fayette for about 18 years in a different variety of jobs. I've worked with the rehab, worked with inpatient as well as outpatient. And about almost 2 years ago, we took on a program with wellness for our patients that are traditional Medicare.
With Medicare, there's a Welcome to Medicare visit and an annual wellness benefit. Explain the difference.
The difference between the two is the Welcome to Medicare is when you first become eligible for Medicare, whether you're 40 years old or 65 years old, you are entitled to a Welcome to Medicare visit with your physician. During that, they do a variety of testing and such for the first visit you have with them. The annual wellness visit is something that you do every year thereafter, and it's something that's provided for all of the traditional Medicare patients.
I see. What happens at the Welcome to Medicare visit?
You call your doctor. You can make an appointment for that first Welcome to Medicare visit. He will do a variety of screenings. They will look and check your gait, your balance. They'll do a depression screen. They can verify all your medications. They check your cognition, which just means, how is your memory, things like that. They'll go over a lot of different types of screens that Medicare encourages patients to do. And they actually do a physical exam during that first Welcome to Medicare. It usually takes a little longer than what your normal visit is when you go to the doctor. And it's, again, that's only a one-time. That's just when you first become eligible for Medicare.
See?
So what if I didn't get my Welcome to Medicare exam within the first year?
If you didn't get it within the first year, then you would be eligible for just the annual wellness exam, and that would be, again, the very first one. You only have the ability to do the Welcome to Medicare once, as well as the first annual wellness visit. So if you didn't receive the first one, you would do your annual wellness visit, and from there on, you would do a subsequent one every year after that.
Okay. And can you explain what happens at the annual wellness visit?
The annual wellness visit can be done by the nurse in the office where the doctor is at, or the nurse practitioner. At that point, they are looking at those screens that the doctor may have done in the original Welcome to Medicare, and they're looking to see if you've had changes during that last year. If you didn't have the initial one, then it's just a baseline. because we want to be able to look at patients and see how are all their skills today, so that when we look at it a year from now, we can see have they made changes, improvements, declines, any of those things that we could be able to address to try to keep that patient healthy as long as possible.
Anita, is there any cost for the wellness exams?
The annual wellness, as well as the subsequent ones, and as well as the traditional Welcome to Medicare, those are all 100% covered by Medicare. There's no co-payment, there's no out-of-pocket deductible that you have sometimes when you go to the doctor for regular visits. And I think that's one reason why Medicare wanted to make this more readily available for the patients, because there is no charge for it. Medicare accepts whatever the facility is actually contracted with to pay for those, so the patient would never receive a bill for those.
I see. How about some of the preventative services? What sort of things are covered 100% out of pocket, let's say?
There is probably about 18 to 20 things that Medicare recommends for the Medicare patient. And depending on your age and your sex, as far as whether it's something that we would do for a male or a female, and then according to your age, they have things that are appropriate for certain age groups. We may have someone that's only 32 years old that's on Medicare, so they may not meet the requirement for preventative services of, for example, a mammogram. But for certain age groups, they would pay a mammogram 100%, and again, there's no copayment and there's no out-of-pocket deductible. There are your annual flu vaccines, your pneumonia vaccines. There's some testing for osteoporosis. There is some diabetic teaching. There's a whole variety of preventative things that Medicare is looking at. Again, going back to, we want to make sure that we're catching things early versus late. And if you get those preventative things done every year, then we can find things maybe that's just kind of subtle changes, but we can pick it up when we do those exams.
I see. Great.
How long does the annual wellness visits take to be completed by the physician's office?
Usually about 45 minutes. Now, if they have seen that doctor routinely throughout the year for their regular visits, for their follow-up to their hypertension or their diabetes, they're going to know that patient a little more. But if they've not seen a doctor for a number of either months or years, then it may take a little longer because they need to get a thorough history, find out what kind of family history they have so that they can start looking. Say if my parents both had cancer, I'd want to be really in tune to looking at what kinds of issues that patient may have that I need to verify. You know, do I need to do some screenings on this person because of their family history?
Okay. And after the annual wellness visits, what other services are provided through Medicare?
After they've done the annual wellness visit, they again would have one of those every year within 366 days. It can't be any sooner because they're very specific on it can't be more than once a year. Once they've done that, then a lot of things can happen from that. They may need to order a mammogram. They may need to order lab work. Another thing that Medicare looks at is if you've never had your cholesterol and things like that checked, that's a good way to verify if your heart is in good shape because of maybe your cholesterol and your triglycerides. So if you've never had that, they may schedule some of those types of testing afterwards. And then we also have what they call a chronic care program. And once the physician or the nurse has done that either annual or that Welcome to Medicare visit, the doctor can then order for chronic care management. And that's a whole nother program we have at the hospital for those patients that have chronic conditions. And chronic conditions are such as diabetes, a stroke, they've had hypertension. They have lots of different things that per se would not be well within a year. In other words, if you're a diabetic, typically you're a diabetic. If you've had a stroke, it's not going to go away necessarily. You may still have some of the symptoms from that. So with those chronic conditions, Medicare allows, if you have at least 2 of those chronic conditions, then you can be managed by a chronic care management program. And we started that program again almost 2 years ago. And we have about 230 patients in that program right now. We also take those patients and we have a 24-hour nurse line that they can call at any time. And when they call, they can have an issue from my toe is sore to, I have something very severe. But they would triage that patient just like as if you were in the emergency room and ask the questions so that they can give that patient the direction on where they may need to go. Once that call has been made, then that also gets an email to the chronic care management office at the hospital. And then the nurse, myself, or one of my partners that's in there, we actually call them the next day and check on them to find out how they're doing. Because sometimes they may say, you just need to see your doctor in the next few days. Or they may say, you need to go to somewhere aggressive, like an emergency room, if it's something severe. So what we do is we follow up on those patients that have made those phone calls. They call us. We call them throughout the month. Sometimes we've got a lot of those patients that come and see us once a week. The minimum requirement for the chronic care management program is to at least evaluate them by talking to them, looking at their charts, meeting with their physicians, their family, at least 20 minutes a month, every month. But some of our patients we see 20 and some we've got a few that they're there quite often. So we try to keep that into the chronic care management program so that we can keep our patients as healthy as we can.
Awesome. That sounds like a great program. Well, thanks so much for stopping by, Anita. We appreciate your
Thanks for
time
having me.
and a lot of good information.
Thanks again, Anita.
You're welcome.
We'll be right back.
Welcome back. That's all the time we have for today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Renee Nesbitt.
And I'm Doug Fischesser. Stay healthy, Connersville.